The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, and I'm your host, Bob Roth. And it is Friday. Hard to believe it's August 12th, and we are in the dog days of summer. And not just here in Arizona, throughout the country. And saw the weather map in other parts of the United States and down in the Gulf states it's not only bloody hot, but they're getting a ton of rain. I heard they're getting like 12 inches of rain today, and that's unfathomable. Although we've gotten our fair share of rain, yesterday morning it was like the floodgates had opened. But I'm back, and last week I had in my stead Michelle Toff, who is our Director of Memory Care Programs, and had Andrea Garcia, who is our Director of Client Services, hosting the show, and they did a wonderful job in my absence. And if you're just tuning in, this show is called Health Futures, and it's about taking stock in you, and specifically it's about how does our older adult population live a healthier, happier life. And we're able to have this show on the air for now 3.5 years because what we do is we bring incredible guests to the show, and the guests that we bring to the show bring amazing content, and those guests really run the gamut. And it is, anything from physicians to specialty physicians to health plans, long-term care insurance, disease organizations, you name it, anything that I can bring to you as our listening audience, the experts about living a healthier, happier life. I and my family, we own a home care agency, and we enable so many of our older adults to be able to stay at home by providing care in the home. And some call it non-medical. I prefer to call it in-home care services. And we're able to do this by delivering incredible caregivers that have passion, that have heart, and want to make a difference in somebody's life. And I make this appeal to our listening audience. One, if you have a loved one that you're worried about that might need an extra pair of hands at home, an extra pair of eyes, somebody to watch over them, I implore you to look into companies like Cypress Home Care Solutions to help you. And then on the other hand, if you are one of those caring, compassionate people, or if you know somebody that wants to make a difference in somebody's life, please have them call out to Cypress Home Care Solutions. Caregivers are really the unsung heroes out there that are making so much of a difference in our older adult population's life. So I'm going to cut right to the chase, and I'm going to get right into it. I have an extraordinary guest who's been on my show before, and he is here now in a different capacity. He's I'm an advocate in companies, whether you're a not-for-profit or a corporation, from promoting within. And my guest today is Dan Lawler, and Dan is with the Alzheimer's Association Desert Southwest Chapter. And I believe when you joined that organization many years ago, you were part of the development team. You were like VP of development or director of development.
Correct.
And now you've worked your way up to be the exec director. Well, congratulations, and welcome back to the show.
Thank you so much. It's my pleasure to be here. It's a great forum to get information out to your listeners.
Well, thank you. And Alzheimer's is something that is very prevalent in our communities. And there's so many forms of dementias out there, and Alzheimer's is one of them. Mm-hmm. And, it's a topic that we've talked about here on the show multiple times. And, a lot of people don't realize this, but this is kind of a mecca in terms of research, a mecca in terms of new ways to deliver care. We got this thing called the Arizona Alzheimer's Consortium. We've got Banner Alzheimer's Institute. Mm-hmm. We've got the St. Joe's Barrows Institute. Mm-hmm. We've got TGen and that group. I know I'm missing others. Sun Health, which is part of Banner, and their research and development. It's amazing some of the stuff that's happening here.
Correct, and I think it's something the residents here in the Valley and in the state of Arizona can truly be proud of, is when you talk about Alzheimer's research, who's leading the way, who's blazing the trail. Truly, Arizona is at the forefront that in terms of the research programs, the clinical trials going on, some of the cutting-edge things being done, just as you say.
New models of care?
Exactly. It is all happening here. So we are at the forefront of, hopefully, the revolution in Alzheimer's research and care.
And we also just recently, I think, a city here in our community, it was at Tempe, that now is an Alzheimer's-friendly mm-hmm. city, and the merchants there are trained on how to work with patients that have dementia and Alzheimer's.
It's truly a new model of how to approach it, the dementia-friendly cities model, which we've promoted, and we partner with the cities in helping train staff and helping train governments on. But being cognizant and being sensitive to individuals with Alzheimer's who are out in the community, the caregivers who are going to be supporting them, as we discussed before this program came on, this is an epidemic, and the number of people affected and who it's affecting is just growing by leaps and bounds. And so getting out in front of it and having this education, having this dementia-friendly and dementia-capable cities, I think is a great new model of care, and I think is the wave of the future.
Some of the stats that I'd love to share with our listening audience. Presently, approximately 5.4 million Americans mm-hmm. are afflicted with this disease, with over probably 50 million people delivering care. Mm-hmm. They're predicting by 2030 that this number is going to more than triple. And they're talking about it costing our economy somewhere between $1.2 to $1.4 trillion, not billion dollars. It is devastating. I had the pleasure of having Dr. Pierre Theriault on the show from the Banner Alzheimer's Institute, and he basically referred to it as being pandemic. Mm-hmm. We've got to find solutions.
Correct, and this is the sheer size of the problem is something that we can't wait till it does triple in the number of people and the number of cases. It's something that we need to address now, that we need to find interventions now, that we need to see how can we modify the trajectory of this disease now so that it doesn't come and overwhelm us, in the next 20 years.
Well, one thing I will say is the Alzheimer's Association has really done a remarkable job.
Thank you.
I have been at the helm of Cypress Home Care Solutions for 13 years, and your organization was the first organization I aligned with. Your predecessor, I remember calling her and saying, hey, I'd love to get together. We went out to lunch, and I said, how can I help? And for 4 consecutive years, I chaired your memory walk in Phoenix. I assisted taking this memory walk that made about $68,000. They would have loved to have had millions of dollars.
We would love
$68,000 to over $200,000 in 4 years, and now you guys are doing such a phenomenal job. I think the most we got was about 3,000 walkers, but you guys are getting close to 10?
Yeah, we're getting over 10,000 walkers, and that's happening this fall. So people can join up, register today. So
let's give that out right now, because there are a couple of things I want to talk about, and I know we're coming up on a break. We've got 2 walks that are coming up. We got one in the West Valley, and we've got one right here in Central Phoenix. Correct.
The one in Central Phoenix will be downtown at the Wesley Bullen Plaza. And the one in the West Valley will be at Beardsley Recreation Center. People can find out information and go on to sign on to those at walk.org or alz.org/walk. So
alz.org/walk.
And that way you can find the walk closest to you. You can find information about both of those walks.
Fantastic. You know, Dan, there's a number of things I want to talk about when we get back from the break. You know, one of the things I want to talk about is I want to talk about this international conference that just concluded, and I want to talk about the results and some of the things that you learned. I also want to talk about the myths, because there's so many myths out there about Alzheimer's, and a lot of people think Alzheimer's is only a disease for old people. Right. We'll bust that myth when we come back from our break. We're going out with a little bit of Eric Clapton. Thank you, James, for doing a little bit of that. You're listening to Health Futures, Taking Stock in You. My name is Bob Roth. I'm your host, and I've got Dan Lawler from the Alzheimer's Association Southwest Chapter. Time for a break. We will be right back.
High returns on your investments? Who wouldn't want that? This is Sinclair No, with a strategy that could increase your overall return on your investment portfolio. It's called Decadian. The Decadian investment methodology encompasses a 10-year goal for financial freedom, plus something that's really missing today, straight talk, so you know you have a financial advisor you can trust. Great investment recommendations that far exceed what your institutional markets offer. All this wrapped with performance guarantees. Only those who know what they can do will guarantee what they can do. Decadian. Decadian.com. Decadian. That's Decadian.com. Call 844-332-2342. 844-332-2342. Here for you when you need it most. Decadian.
Get total freedom in your life safely and quickly. Build wealth and passive income so you never worry about working till you drop, losing your job, or retiring in poverty. Hi, I'm Steve Davis, an investor in thousands of units over the years. Now it's your turn. Del Walmsley has been my mentor for nearly 25 years, and he's taught over 100,000 people just like you the principles of financial freedom through live one-on-one mentoring at Lifestyles Unlimited and his national radio show. I'm excited to tell you about the real estate workshop that changed my life. The workshop gets you on the inside of what we do and what we believe and unlocks the 5 ways we make money in real estate. Just like your personal trainer, Lifestyles Unlimited will motivate, encourage, and teach you so you can get in the best financial shape of your life. Call 866-971-8970 or go to luiphoenix.com. That's luiphoenix.com to register for the workshop that will change your life and let you stop worrying about working till you drop, losing your job, or retiring in poverty.
Join Daniel Bustamante, co-founder of Landshark Analytics and LongShortRadio.com, and learn to trade from the pros. Tuesday, 4:30 p.m. on The Financial Review.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth. If you're just tuning in, I've got Dan Lawler. He's the executive director of the Alzheimer's Association Desert Southwest Chapter. And we're talking about the Alzheimer's disease, and we're talking about some of the challenges that come along with it. And I wanted to go back because on the first segment we talked about the Memory Care Walk, and that is really the marquee fundraiser.
Correct.
You know, for me, Dan, it's about awareness and it's about advocacy. And those two are probably the biggest pillars for the Alzheimer's Association.
You know, we've really focused on that over the years, the awareness, letting people know about Alzheimer's, that it's not a normal part of aging, exactly what separates it from other diseases or other forms of natural aging. So the awareness building so that people know something needs to be addressed, so they know to have that conversation with a doctor, I think is very big. And then, as you say, the advocacy. I mean, this is the scope and the size of this disease, the epidemic nature of it. You know, the government needs to step in, and we need to address this, much like we've addressed cancer and HIV/AIDS. It is a disease we need to address, we need to really focus on, so that hopefully we can find a prevention, a cure, treatments. So,
you know, and all of that, cure, prevention, treatments, awareness. You know, I want to go back to the walk just real quickly. There are 2 walks here in the Valley, and if you're here locally, you know, the two, and as Dan had said, you want to go to alz.org/walk.
Correct.
And the two here are the West Valley is on October 15th, and it's at the Beardsley Recreation Center. And the one in Phoenix is at the Wesley Bowen Plaza, and that's on November 12th, 2016. And, Dan, the thing about this walk, and having been associated with the association now for over 13 years, you guys are doing, as far as awareness, you're promoting this walk in the early days of the summer, months beforehand. So you're really doing a great job of getting the awareness out there. But you also have Hollywood behind you, too. You've got actors like Bradley Cooper, and you probably can name some of the others that are out there doing it. But
well, David Hyde Pierce and Seth Rogen and Dick Van Dyke. I mean, I think as we see the prevalence of Alzheimer's, it really 1 in 4 people are touched in some way with this disease. They know somebody, have a close family friend, or they themselves are touched. I think it starts to have that conversation to be had where people are more willing to come out and say, you know what, I have been touched. A close loved one of mine is affected by this disease, and they want to bring awareness to it. They want people to get help to get that diagnosis.
It's interesting. I gave the statistic about 5.4 million people. Those are diagnosed people.
Correct.
How many individuals are out there that are undiagnosed?
It's a scary thought to have. And when you think about it, every 66 seconds someone develops Alzheimer's disease. I mean, over the course of an hour, almost 100 people are developing Alzheimer's. It's staggering.
It's scary. It is scary. And I want to just, deliver this message out to our listening audience. I mean, you got to be looking for signs. And, forgetfulness is just only one part of it. Hygiene's another, bumps and bruises or others. Do you have any tips to the trade, if you would?
Changes in behavior. I would say if people loved a particular activity, somebody loved to bike or somebody loved to quilt or crochet, and then suddenly they just lose interest in it. What we've seen, individuals who have Alzheimer's disease are very good at diverting and covering up that something might be wrong. I mean, we all do it. I mean, it's a natural tendency. So they might say, oh, I've just lost interest in quilting. I've done it for 30 years. But when you start to break it down, people might give up a love or a hobby they have because they just can't remember all the steps in doing it, to get the needles, to get the yarn, to do certain things. It's a complex task. And so we always say if people are changing their behavior and patterns in those ways where they're losing interest in things that they used to love, that could be a warning sign. As well, a common thing that I always say to people, if your loved one, it generally takes them 10 minutes to make a trip from the grocery store to home, and it's taking them an hour and a half, that's a conversation to have. And are they getting lost along the way? Are they getting confused? Or are things happening that we need to address?
That's a scary thought that we have a lot of people behind the wheel that are afflicted with this disease in some form or fashion. Correct.
And it's a big issue in this country. I mean, this country is a very independent focused country in terms of, that driver's license. People want it when they're 16, and it is that license of independence.
Right.
And so people are reluctant to give it up, and loved ones are reluctant to have that conversation because it's a difficult conversation to have as to, should an individual be driving if they have Alzheimer's or if there is some sort of memory issue? And that's something that we can help about at the association. We have social workers on staff that can help have those conversations and facilitate that kind of family meeting and planning for individuals who are affected and need that conversation.
Let's talk a little bit about that.
Sure.
I know I was going to get into another topic, but now that you brought that up, I mean, I want our listening audience to know what this Desert Southwest chapter can do. Talk to us about a listener that may be listening in, maybe seeing some of the signs. First of all, I want to give out your number. And please keep this number close to you. And if you don't have it, and you don't have a piece of paper in front of you, go to alz.org/DSW, which stands for Desert Southwest Chapter. But 602-528-0545. So tell us a little bit about what they can do when they make that phone call.
We're here to help truly at any stage of the disease, any stage along the journey. people can call us and say, hey, I just saw my mom or my dad. I'm a little worried about something, or even a spouse or loved one, or even a neighbor, family, friend. We can provide some of that information if you're worried about warning signs. We can provide information about if you're going to go to the doctor. What are some of the things you need to talk about and discuss? What are the questions to ask, and what to talk about in terms of that? Because getting a diagnosis, determining what is wrong, if anything is wrong, is very important. Because once you know, then we can treat it, then we can care plan for it, and so we can help people that might be caregivers, they might be long-term caregivers, they might be beyond, they already have the diagnosis and they've been caring, but it gets harder over time. We can help them, obviously, with care planning. We can help them, hook them up with resources such as Cypress and other resources in the community so that they have the support.
Specialists,
True.
Like a specialist, like a neurologist or somebody that could maybe help them with the diagnosis.
Very true. And one of the things we talk about, too, when we work with family caregivers is, you need to take care of yourself as well as the individual with the disease. So often do we see family caregivers so focused on the individual with the disease that they want to take care of them that they might otherwise not focus on their own health. And that's just as dangerous and just as problematic as if nobody were caring for anyone. So we want to make sure that the entire unit is taken care of and that people have the best quality of life through the entirety of the disease.
As far as the awareness and advocacy, and you and I know the behaviors that come along with this disease and other dementias. We have done a good job, but not a great job. We need to do a better job with our civil servants. And I'm talking about our police force, the Maricopa County Sheriff's Office, the firefighters, because a lot of times people display some of these behaviors and they're in the throes of the disease, and that's not really who they are. And that's hard. And I know we've done good, and good's probably a good word to describe it, but we can definitely do better.
We can always do better. I will say this, over the past, 2 to 3 years, we've really made great strides in working with some of the local city police departments, also in conjunction with the Dementia Friendly Cities Initiative. But, with Phoenix Police Department, Prescott, down south in Tucson, and some of the other valley cities, where we're going out and we're training police, first responders in terms of how to interact, how to identify the person might have dementia. Because you're right, they might present as having some other issue. So working with them on how to identify and then also how to interact and try to de-escalate a situation so that it's not creating more agitation and a bigger problem.
Yeah, and that's so critical. It really is, because, I think oftentimes in the past, someone would just make a comment about the person may be crazy or something, and it's not that.
It is not.
These are human beings. These people have, whether it be children or they may have parents, they may have siblings. I mean, they're just like you and I, and you know what? They have rights, and we need to protect those rights.
It's no different from somebody who might have cancer. It's an individual, and they have a disease.
Right.
And so they are still an individual. We need to treat the disease.
And, it's really cool that you guys are helping many of these, civil servants, for lack of a better word, to be able to divert and be able to redirect them so that they can calm down a situation, because it can get a little hairy.
Correct.
We're up against another break here. It's hard to believe it.
Time flies.
But James has got some great tunes going today. It is Friday, August 12th. We're coming at you live from the Scottsdale Air Park studios of Money Radio. You're listening to Health Futures. I've got Dan Lawler in the house. It's halftime. We'll be right back.
As we reach the bottom of the hour, we pause for a look at the world's news. Then we're back with Money Talk. We're Money Radio 1510 and 99.3 FM.
Republican National Committee Chairman Reince Priebus showed up with Donald Trump at a campaign rally in the key battleground state of Pennsylvania this afternoon, a demonstration, he says, of GOP party unity. The candidate, meanwhile, was walking back his charge that President Obama is the founder of ISIS, sort of.
So I said, the founder of ISIS. Obviously, I'm being sarcastic. Then then, but not that sarcastic, to be honest with you.
Hillary Clinton released her 2015 income tax return today, and Chris Freitz reports campaigning has cut her income from $28 million in 2014 to $10 million last year.
Last year, if you take a look at what she paid in income, about $28 million in 2014. So we've seen that the fact she's going on the campaign trail, she doesn't have a book out, she's not doing the paid speeches. Most of the speeches she's doing now are for free or for fundraisers to help her campaign.
Louisiana in a state of emergency because of heavy rains and flooding. Excessive heat watches in effect along the East Coast. I'm Michael Toscano.
This is Charles Osgood. Whether traveling or working remotely, we know your PC is your business headquarters. And when work takes you on the go, you need a laptop that can keep up. Dell's XPS 13 empowers small business owners to collaborate anywhere with incredible battery life and powerful performance. Reduce downtime by 50% and boost productivity with 4 times faster performance when you refresh to new Dell PCs featuring Intel Core processors. Visit Dell.com/radio.
ADT presents What to Consider When Considering Home Security. An ADT sign is more than a sign. It's a line in the sand. On one side, your family. On the other, an uncertain world.
For over 140 years, more people have chosen ADT to help prevent crime than anyone else. Get ADT starting at just $28.99 a month.
Tested, trusted, proven ADT.
With 36-month contract for licensing and terms and conditions, visit ADT.com.
When the sun goes down, Money Radio heats up with Gary Kaltbaum, Clark Howard, and The Schnitt Show. Listen to Money Radio on 99.3 FM, where you can hear us all day, every day.
Right after business for breakfast, right after the news on Money Radio, tune in Mastering Money with wealth manager Steve Jurich and the doctors Sinclair Know. Learn about cutting-edge retirement investment strategies, Social Security optimizing, and RMD strategies. Guests on Mastering Money have included Steve Forbes, Larry Kudlow, and the one and only John Bogle, the founder of Vanguard. Join the A-Team, Steve and Sinclair, mornings Monday through Friday at 8. And now, download the Mastering Money app for your Apple, Android, and Windows devices.
Laura Bramnick is a real estate agent and a real estate attorney. Laura Bramnick knows that a good attorney safeguards her clients and their well-being. Each decision or direction she and her clients make together is with one purpose, the most effective resolution, for now and for the future. For more information, visit talkrealestateaz.com or call 480-624-2705, 480-624-2705. To talk with Laura, call 480-624-2705.
Scottsdale Cigar Club is without doubt the friendliest cigar store and lounge in the Valley of the Sun, conveniently located in the Scottsdale Air Park at 14525 North 79th Street. Our phone number is 480-946-7833. 350 choices of cigars. We are open to everyone 7 days a week. Free Wi-Fi. 7 TVs on one wall. Hope to see you there.
Hey, Money Radio listeners, this is Gary Kaltbaum. Make sure you tune in for my show, Investor's Edge, heard daily at 6 p.m. You'll get my take on the markets and the world and what to look out for tomorrow. Investor's Edge is one of Money Radio's longest-running shows, so don't miss it. Listen daily at 6 p.m. on Money Radio 1510 a.m. or 99.3 FM.
Your one blood donation can help save the lives of up to 3 people. Give blood through the American Red Cross to help hospital patients. Call 1-800-RED-CROSS or visit redcrossblood.org today.
I'm Bruce Vail with Your Money Now. Google says it will send you new warnings when you're getting sketchy email. Google's Gmail service already features many warning messages, but the new alerts will help in 2 specific situations. They'll tell you if you get an email with a link to a website known for hosting malicious software, or if Gmail can't authenticate that an email sender is who they say they are. Retail sales were unexpectedly flat in July as we cut back on purchases of clothing and other goods. Sales were unchanged last month following an upward revised 0.8% increase in June. Sales, though, are up 2.3% from a year ago. The sales report has been weighing on the stock market today, though the major indexes are now mixed. The Dow Jones Industrial Average is still lower, down 52 points, but the NASDAQ Composite is up a fraction, and the S&P 500 is down 3 points. That's your money now.
If you run a business, plumbing, HVAC, or construction, you know that some vans are too small.
We're gonna have to make 2 trips.
Others too big.
Watch the top! Watch the top!
That's where the Mercedes-Benz Metris comes in. With unmatched safety features, a 2,500 2-pound payload, and enough cargo space to hold over 60 sheets of 4x8 drywall. It's big enough for the job, yet it's small enough to fit in your garage. It has a service interval of up to 15,000 miles, and the highest residual value in its class, according to ALG. During the limited-time Metris Summer Savings Event, save $3,000 on all 2016 Mercedes-Benz Metris models. Mercedes-Benz. Vans born to run.
Offer valid only to qualified customers for purchase or lease of eligible 2016 Mercedes-Benz Metris vans. Cashback only available on the purchase or lease of a 2016 Metris van from new dealer stock. See your authorized Mercedes-Benz Vans dealer or mvvans.com website for full offer details. Offer ends August 31st, 2016.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth, and I've got Dan Lawler, the Executive Director of the Alzheimer's Association Desert Southwest Chapter. If you're just tuning in, we're on our third segment. Mm-hmm. And we've been talking about the Alzheimer's disease, and we've been talking about awareness. We've been talking about advocacy. We've also been talking about how this is really pandemic. I mean, correct, what it's going to do to our society, our economy is going to crush it. Mm-hmm. And, for me, Dan, one of the biggest challenges I've had, and, we're in the political season right mm-hmm. now, and we're not going to get into specific politics, but I don't think I've ever quite seen it like it is today. So, politics seems to take front and center. It's on the headlines of the news, whether it be the newspaper, whether it be the television, you're watching the news shows, or you're watching, or reading the blogs and the internet. Mm-hmm. But the one thing that was really, really challenging for me, having watched both the Democratic and Republican national conventions, is not one mention about older adults, mm-hmm. not one mention about Medicare, mm-hmm. and not one mention about this devastating disease. Mm-hmm. And, you talked about in the last segment, talking about cancer and some of the others that have gotten great notoriety. And Susan B. Komen, I mean, our hat's off to them mm-hmm. in terms of the awareness that they have brought to breast cancer is nothing short of phenomenal.
Correct.
And, the progress that they've made and the breakthroughs that they've made. I have a family member that has breast cancer, and, she's a survivor. There are more survivors today that I truly believe, and I think you concur, and so does our listening audience, because of the awareness factor and the money that Susan B. Komen has raised for breast cancer.
It's true, and I think when you talk about the conventions, when you talk about politics and political season, first and foremost, I have to say I do have to give credit to our elected officials because over the years that I've been with the association, more of them have at least paid attention to and have rallied around the cause of we need to do something about Alzheimer's. In terms of the federal funding, we've seen federal funding more than triple for Alzheimer's disease over the last few years, which has been great. And what I will say to the listeners and to everybody who holds this dear to their heart, and that is it is a direct result of people using their voices and speaking out.
Thank you.
To reach out to elected officials, both in the state as well as federal level, to say this is an issue that matters to me. This is an issue that we need to address. It is only through those voices, because there could be people like you and me who might raise our voices, but when everyday citizens are calling their representatives, taking that time to reach out, it actually does have impact. It has meaning. And so I encourage your listeners to reach out to say, this is important. We need to address it. We need to focus on it. We need to do something about it now, not sometime in the future, but now.
I'm so glad you mentioned both state and federal, because I know that we get funding from the state here of Arizona. And it's so important for us to realize that, like you said, we can make a difference. We can make a difference in getting funding, getting policy, getting what we need to help our family, our community be able to stave off this disease and come up with resources.
Very true. And as I say, we've seen a lot more support on the federal level for Alzheimer's research and care. One of our big priorities has been the HOPE Act, which is, focused on that. I will say this, and something that the listeners can do today is that the Centers for Medicare and Medicaid Services have proposed what's being called the HOPE regulation, which means that individuals who are visiting their doctor can get care resources reimbursed by Medicare and Medicaid at those doctors' visits. It's a portion of the HOPE Act, and sort of the Center for Medicare and Medicaid Services some might say they're jumping the gun in terms of they're moving forward with implementation of this part, changing this regulation because they see the need now. And right now it's an open comment section. They're inviting feedback from the public to make comments about should this regulation be implemented, how do they feel about it. So your listeners can reach out now. They can say, hey, this is a great thing. This is, individuals are going to be able to have Medicare and Medicaid pay for, Alzheimer's care services, those more social and supportive services for individuals with this disease. That's a big step.
And I'm so glad you brought this up. And personally, I was not aware of this act. And I love acronyms because HOPE has two meanings. Obviously, hope for us finding a cure and finding a way to eliminate and eradicate from our community this disease. But HOPE actually stands for Health Outcomes Planning and Education for the Alzheimer's Act. And it is extraordinary that we have got this. And again, it's through our voice.
It's true.
It's through our voice and really speaking to our legislators.
It really is, and I think that is seen every day. I know that, like yourself, Bob, I probably do see and have some fatigue with the political system, especially during a presidential election year. But I will say this, when individuals see causes, and I know you're right, Susan G. Komen has done great things, and even non-medical causes, when you see that people take attention and pay attention to them, it is because of the voices of individuals taking time to raise them, to speak out and support, and to say this matters to me, because the more people that do it, the more your elected officials are going to pay attention to it.
We have to create this movement.
We do.
The movement needs to move forward. Susan B. Komen did it. We can do the same. The progress has been nothing short of phenomenal, but we still have a long way to go.
That's right.
Let's talk a little bit about this conference that that just concluded in Toronto last week. I know there's some really cool new research information.
It is. The Alzheimer's Association hosts an international conference, AAIC, the Alzheimer's Association International Conference, every year, where we bring together some of the top researchers around the world into one place to share and update and talk about research, whether they be through plenary sessions or through presentations, through panels. I will say this, I have been to the conference. A lot of it is over my head. If you actually do go and sit in sessions, it is very much researcher to researcher talking, which is an important conversation to have. This year we had over 5,000 people.
Wow.
Come to the conference. And I will say this, the one thing that I would like to say about the outcomes from the conference, because everybody is always very interested in that. A lot of times people think of Alzheimer's research and they just think of the pharmacological interventions, but I will say it's much more beyond that. A lot of what came out of the conference this year is about early detection and finding ways to further diagnose so that we know what's going on, into preventative care and how care can affect long-term people progressing with the disease, as well as hopefully preventative measures and healthy lifestyle and living, and what kind of ramifications those have as the disease progresses. So AAIC shared a lot of that information, and people can go on to alz.org www.alzheimersfoundation.org/AAIC for the Alzheimer's Association International Conference, they can actually read the different sessions that came up, hopefully white papers that summarize them and get some of that information. But I'm very excited to see a lot of the focus on the care side, the detection side, and the support for people with Alzheimer's beyond just pharmacological treatments.
Sure, and it's so important. Like you talked about the care side, and that's the space we're in. And over the last year, we created a program to help those families that are dealing with this disease keep their loved ones at home.
Yes.
I mean, one of the things that we do know, that as much as everybody wants to age in place, older adults that are afflicted with this disease, the longer we can keep them at home, the better off everybody is. It's the least costly proposition for care. And there are three things that we all have to remember. One is we need socialization for those that are afflicted with this disease. Two, we need to make sure that they're eating, because Alzheimer's, for some reason, that disease disconnects the brain from the stomach. And then lastly, we need to make sure whatever medications they're on, that they take the right doses at the right time to really delay or prevent the onslaught of this disease. I mean, those are very important pillars to making sure that somebody is getting the care that they need at home.
Yeah, I mean, people being safe, healthy, and happy at home, it's better for everybody involved.
It is. And I can't believe we're 3 down. We're 3 down.
It flies.
Well, the tunes are happening over there, James, so thank you. Thank you for taking us out on the third segment. Dan, we got one more segment coming up. I talked a little bit about myths. I want to share these myths with our listening audience and see if you can bust those myths for us.
Sounds good to me.
All right, well, you're listening to Health Futures. I'm your host, Bob Roth. I've got Dan Lawler in the studio. He's the new executive director for the Alzheimer's Association Desert Southwest chapter. We're also going to talk about the upcoming memory walks.
Okay.
We'll be right back.
Hi, I'm David Goldstein, CEO of Arizona's premier collateral lender, Biltmore Loan, and I'm proud to announce the grand opening of our new landmark location, 10830 North Scottsdale Road, a block north of Shea. If you need cash for personal reasons or business needs or really anything at all, we can turn your significant assets into significant cash instantly, because Biltmore can buy or loan on almost anything you own, from car titles and fine watches to real estate and even business assets, including short-term and bridge loans. And while our office is brand new, you'll find our way of treating people is old-fashioned. We treat you with respect, dignity, and honesty. And when we give you our word, you can take it to the bank literally. Please stop by, go online at BiltmoreLoan.com, or call 480-991-LOAN. That's 480-991-LOAN. At Biltmore, we say yes when the bank says no.
High returns on your investments? Who wouldn't want that? This is Sinclair No, with a strategy that could increase your overall return on your investment portfolio. It's called Decadian. The Decadian investment methodology encompasses a 10-year goal for financial freedom, plus something that's really missing today, straight talk, so you know you have a financial advisor you can trust. Great investment recommendations that far exceed what your institutional markets offer. All this wrapped with performance guarantees. Only those who know what they can do will guarantee what they can do. Decadian. Decadian.com. Decadian. That's Decadian.com. Call 844-332-2342. 844-332-2342. Here for you when you need it most. Decadian.
Your one blood donation can help save the lives of up to 3 people. Give blood through the American Red Cross to help hospital patients. Call 1-800-RED-CROSS or visit redcrossblood.org today.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth. And we're at our final segment. I've got Dan Lawler in the studio. He is the exec director for the Alzheimer's Association Desert Southwest chapter. I'm going to give out his phone number real quick to the chapter. It's 602-528-0545. Their website is www.alz.org/D as in dog, S as in Sam, and W as in Walter. So that's the way you reach them. They've got 2 marquee fundraising events that really promote awareness and advocacy. October 15th, if you're here locally and you're listening, is the West Valley Walk to End Alzheimer's. It's at the Beardsley Recreation Center. And then on November 12th, it's the Phoenix Walk to End Alzheimer's, and that is at the Wesley Bolin Plaza.
Correct.
So I want to, take us through, or Dan, I want you to take us through some of these myths. Memory loss. A lot of people say that that's a natural part of aging.
There, to a degree, yes. There is some memory loss as we age. However, the degree to which memory loss affects your daily activities, the degree to which Alzheimer's disease and other dementias affect memory loss is not natural aging. So, that's why if somebody just forgets a name, it could be natural. It could be a sign of something more serious. That's why when we talk about warning signs and things to look for, you want to look for multiple signs together. If somebody's just forgetful of names or forgetful of things, that's one thing. I will also say this. Generally, when you're talking about dementia memory loss, it's not just, I can't remember Bob's name. I've seen him before, but I can't remember it. It's, I'm not quite sure if this is my house or not, or, how exactly do I turn on the car? Or is this the kitchen? Where's the toaster? Is that it? Or is that the bread box? I mean, they are more severe lapses in memory than is normal.
So yesterday, when I walked into the kitchen, I couldn't remember why I walked into the kitchen. That's not a sign, right?
That is not.
Or walking into the garage and forgetting why it was there.
That is funny because that is something that I would always tell people when I go out and speak. And that is, who here has been like watching the football games or the Olympics, as we talk about. Right. A commercial comes on, you get up from your chair, you go to the kitchen, and then you sort of freeze because you're like, why did I come in here?
Right.
That is, generally speaking, that is perfectly okay. What happens with people with dementia is they will go in there, they may not recognize the kitchen as their own. Right. Or they'll go in there and then they'll come sit back down, and then literally 2 minutes later they will go back into the kitchen for the exact same thing, come sit back down. It's, it is not normal.
Right,
right.
Not normal. One of the things that was shared with me many years ago, the speaker said, who here has been to the mall and walked out to go get their car and couldn't remember where it was? Mm-hmm. And half the room raised their hands. And the speaker said, don't worry, you don't have Alzheimer's. And she goes, who in here in this room got and found their car but didn't know how to use the keys to get it started? Mm-hmm. No one raised their hands and said, if you were one of those people, you could possibly have Alzheimer's.
Exactly.
So, no, that's a good myth buster for us. So another myth is Alzheimer's disease is not fatal.
Unfortunately it is. Right now, there's no cure for Alzheimer's disease. Once you have Alzheimer's disease, people will pass on from it, or a comorbidity. People who pass on from Alzheimer's, to paint broadly or to paint in layman's terms, your body forgets to do what it needs to do to function.
Right.
Your lungs forget to breathe. Your heart forgets to pump. I mean, it's at some point, if you have the disease long enough,
it's attacking the brain.
It is.
And it's these what they call amyloid plaques that are just, ripping apart the gray matter, and the connections are dissipating. And I think, and correct me if I'm wrong, from diagnosis to death, average is what, 7 to 10 years?
That would be average.
Some have lived as long as, close to 20, but...
Correct. Some people will have a disease and it will be aggressive, and within 2 years they could pass on. But some people, you're right. They could be diagnosed and live 20 years. But average is 8 to 10 years.
So how about this one? Only old people get Alzheimer's.
That's one of the biggest myths. I will say this. Age is the biggest risk factor for Alzheimer's. The older you are, the more at risk you are for developing Alzheimer's.
Right.
That said, people are shocked when I say, people as young as 26 have been diagnosed with Alzheimer's. Alzheimer's is a disease that can affect pretty much any age. However, it is most prevalent on seniors, but we're seeing, especially as diagnostic tools get more advanced, we're seeing people earlier, people who are in their 60s, 50s, and 40s being diagnosed with Alzheimer's.
I mentioned on the first segment that I had the honor of chairing the Memory Walk for 4 years in Phoenix. And we talked about one of the gentlemen that was very much a part of the programs at the Desert Southwest chapter, and that was a gentleman by Dr. John Durbin. And we have this kickoff, and you still have this kickoff to get ready for it. And we had this woman who was 41 years old that had just been diagnosed. And I'm going to tell you there were about 100 people at this kickoff, and there was not a dry eye because she had just gotten a diagnosis. And here it was the second year, and I said to John, John, can we get the same person? And he looked at me and goes, I'm sorry. And I said, what do you mean? He said, she's progressed too far. She cannot do this any longer. And I said, really?
Yeah.
And it's hard to fathom when that could possibly happen.
Yeah.
And, the Banner Alzheimer's Institute is doing some research in Colombia. They have discovered a family, and it's a family of thousands of people that this disease has mutated itself, and every single person in this family will have the disease before they turn 45. And from a research scientist standpoint, it's like a kid in a candy store.
It's a very exciting research study. In fact, the Alzheimer's Association awarded $10 million to help fund that study. It's our largest single gift to a research study. So it's very exciting because, just as you say, everybody in this family has it. And so it's really such a closed system to be able to look at and hopefully find out more information about the epidemiology of this disease, what's causing it, how it's progressing, why is it affecting these people and every single one of them.
One thing I did forget to mention, you talked about the AAIC, which is the Alzheimer's Association International Conference. You went, or did you get the...
I did not go this year.
Did you get the minutes?
I got the minutes.
So, I'm on the board for the Banner Alzheimer's Institute, and we are led by our board chair. His name is Jerry Stead, and Mary Jo, his wife. They were big honorees at that conference.
They were.
I will tell you, leadership is everything, and I am honored to be on that board because this man is making things happen. And it was so nice to have the Alzheimer's Association honor him.
Yeah, and he's been involved with the Alzheimer's Association on a nationwide level. He's a great champion of the cause.
He truly is. Dan, we're wrapping things up. I know there are many other myths out there, and I just want to give you a plug one more time. If you are listening in, you've got a family member that is challenged, and you seek or think that it may be dementia or Alzheimer's, call the Desert Southwest chapter at 602-528-0545. And if you want to help us with the awareness and the advocacy, we got 2 walks.
Yep.
We got one in the West Valley, one in Phoenix. You can look them up at alz.org/walk.
Correct.
Dan, thank you so much. Have a great weekend.
Thank you.
Go USA.
Yes, indeed.
Yes, indeed.
There's no place like home. You've been listening to Bob Roth Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 99.3 FM.
Hi, I'm Johnny B. And I'm Rick the Professor Plum. Every day on Bucket Strategy Investing, we're talking about financial planning, investment decisions, and retirement strategies. We focus on wealth education and the strategy designed for the needs you have today and the goals you have for the future. Tune in to Bucket Strategy Investing and call in with questions. Retirement strategies, taxes, Social Security, and more. That's what we're talking about on Bucket Strategy Investing.
And 99.3 FM.
It's KFNN Mesa, Phoenix.
Good food is good. Free food is even better. Listen for Stump the Chumps Monday, Wednesday, and Friday in the 7 o'clock hour on Business for Breakfast and get your share. The Dow is down 37 at 18,575. S&P down 1 at 2184, and the NASDAQ is down 4 at 5233.
When people want to talk about money, this is the place they come to. And there's more on the way after this break for the latest news. And